Okay, so then this is in your textbook, so things that can affect stroke volume and heart rate. And this is what I want to end with. So heart failure. So heart failure, so this is the inability, very generally, it's the inability of your heart to meet your circulatory needs. So basically your heart isn't pumping enough blood that your body needs. Now, common misconception is that heart failure doesn't mean your heart completely stopped. That's cardiac arrest. But heart failure is more like your heart just isn't meeting the demands of your heart. So, or not your heart, but your body. So again, all the tissues in your body need oxygen and nutrients, and also you need to maintain like fluid balance in your body. You don't want fluid building up in certain parts of your body. You want to make sure all of the parts of your body have enough oxygen. So heart failure means your heart is having trouble keeping up and pumping it up, maintaining the flow of blood to the point where it actually supplies enough blood, oxygen, and nutrients to your body. So think of it this way. Heart failure isn't like failing with a 0%. It's like, I mean, it is possible to like fail a class with like 30%, right? So it's like, it's not the same thing as failing with 0%, but still failing. So that's what heart failure is kind of like. It's not meeting the standards your body needs to maintain itself and keep healthy. And it's a chronic condition, and sometimes it's also called congestive heart failure as well. And symptoms include fluid indistribution and imbalances. And why is that? Well, think of it this way. If you have like, say your left ventricle isn't able to pump enough blood to the rest of the body, maybe the right ventricle is keeping up though and actually pumping more blood to the lungs, but your left ventricle can't draw the blood from the lungs and the pulmonary circuit and pump it to the rest of the body. So this is why sometimes people get fluid buildup due to heart failure. If you can't circulate enough, it starts to back up. It's like having, or traffic, I like to use like the example of the circulatory system like traffic. So what happens if like there's a traffic block or some roads get cut off? Traffic starts to build up over time because you reduce the flow of traffic, right? So that's what happens in heart failure. If you have reduced flow due to the heart not being able to keep up, fluids start to build up behind the areas that aren't being sufficiently pumped by the heart. Yep. So this system is so this is why you often see the coughing, and this is why it sometimes used to be called congestive heart failure. And so what we have here, instead of like the heart the heart's unable to pump enough blood from the lungs, the fluid is actually going to start building up in the lungs if the left ventricle isn't able to actually pump the fluid and keep it circulating. Okay, so then this is why I also brought up ejection fraction. So this is one way of measuring heart failure. So in normal hearts, you should have about, after you fill a ventricle, a normal heart should be able to pump most of the blood. So 50 to 70% is pumped out in a normal heart. But if someone has something like they have myocardial infarction, part of their heart dies and is unable to contract as well, well, they might have a dip in their ejection fraction because they can't contract as much. But if you have something like this, like after my grandfather had like 2 heart attacks, his ejection fraction went down to 30%. So what happens here is like you're pumping out less blood. You're still filling the heart, but now less blood is being pumped out with every beat. So this is what we have. This is one thing they can consider with heart failure. And why don't I have a hard definition for heart failure? Like organizations like the AHA, they always look at the guidelines and kind of like they always update the definition and how they diagnose heart failure. So this is why I don't have a hard definition for you right then. Ejection fraction is one thing cardiologists consider when diagnosing heart failure. Another thing is something called nitric peptides, and if you've taken the endocrine quiz on Lima, this is why I put in there, because ANP and BNP. So these are peptide hormones made by your heart. And they're secreted in response to things like high blood pressure, blood volume, or blood sodium. And this is why they're called natriuretic. So natrium, this is why the chemical symbol for sodium is Na. That's sodium. But uretic sounds like urine, right? So it deals with not only sodium, but also urine as well. So what it does is something called vasodilation. This is why I'm ending with this, because it kind of leads into the vessels. We'll get to that. And also inhibits sodium and water reabsorption. So you retain less water, and you retain less sodium in your body. So you actually start to urinate more of your water, and you also urinate more of your sodium. So the thing about natriuretic peptides, they're made by your heart to tell your cardiovascular system and your kidneys, like, hey, I'm working really hard. Can you kind of reduce some of the pressure on me, because I'm really being overstressed here. So this is kind of like natriuretic peptides are kind of like a SOS signal from your heart to your kidneys. So ANP stands for atrial natriuretic peptide, so it gives you a big hint of where it's produced. This is produced by the walls of your atrium. Now there's something called BNP, stands for B-type natriuretic peptide. And what it does is that it's produced by the ventricles. So sometimes it's also called ventricular natriuretic peptide. But the thing is that old texts, so when it was a little story time, so it used to be called brain natriuretic peptide. That's the person who first identified it and discovered it. They discovered it in the brain. I forgot of which animal. I think you have to look at the history textbooks. But thing is that it was discovered in the brains of animals, but in humans, the big source of BNP is actually from the ventricles of the heart, not really from the brain. So yeah, these two peptides are also important diagnostic markers for heart failure. And they often measure levels of these hormones, because the more of these peptides you have, the more your heart is kind of stressed out, because again, why is thinking, okay, I'm dealing with too much workload, I'm being overworked. I'm going to secrete this peptide to reduce the blood volume and pressure, so that I'm less stressed by all the pressure and having to pump this volume of blood. Okay, so then that is it. So heart failure, cardiac output, and heart rate, and stroke volume. So this is all the stuff that we didn't cover everything I wanted for the heart, but we still have to cover the vasculature and the respiratory system and some of the lymphatics. So again, we did cover a lot from the heart. So I'll see you all on Monday. I'm hella over time. And thank you all for those of you who stayed over. Yeah, I know that you have a lot of great questions, but we kind of needed to finish today. And actually, I think some of you have your pack back questions either for this week or next week, so it was a good discussion.